Hi everyone, welcome back YouTube channel. Today, we are discussing a major topic that has been getting attention across the country. Senate approves Elder Care Act, what it means for all seniors and retirees. In this video, we will explain what this new Elder Care Act is, why lawmakers approved it, what kind of support seniors and retirees may receive, how healthcare and caregiving services could change, what families should understand about the proposal, and why this issue matters for millions of older Americans. This video is for educational and informational purposes only, and viewers should always follow official government updates and verified announcements for final policy details. The Elder Care Act has become an important topic because many seniors across the United States are facing rising living costs, increasing healthcare expenses, higher prescription medication costs, housing challenges, and long-term care concerns. Lawmakers have been under pressure for years to improve services for elderly citizens, especially for retirees living on fixed incomes. Many older adults depend heavily on Social Security retirement benefits, Medicare, Medicaid assistance programs, veterans benefits, retirement savings, pensions, and community support programs. Because of inflation and rising expenses, many seniors have expressed concerns about affordability, healthcare access, transportation, caregiving support, and financial stability during retirement years. According to discussions surrounding the Elder Care Act, the legislation focuses on strengthening services and support systems designed for older adults. One major area connected to the bill is healthcare access. Seniors often require more medical care than younger adults, including regular doctor visits, specialist care, rehabilitation services, prescription medications, nursing support, and preventive care programs. Lawmakers supporting the bill say that improving elder care services could help seniors maintain healthier and safer lives while reducing pressure on emergency health care systems. Another important issue is long-term care. Many families struggle with the cost of nursing homes, assisted living facilities, home health aides, and caregiving support. Long-term care expenses can become extremely expensive for retirees, especially for those with chronic medical conditions. Supporters of the legislation argue that expanding elder care services may help more seniors remain independent and receive care in safer and more affordable environments. Another reason this topic matters is because the senior population in the United States continues to grow. Every year, millions of Americans reach retirement age, which increases demand for healthcare workers, caregivers, retirement services, and support programs. Experts have warned for years that the country needs stronger elder care infrastructure to meet future needs. The Senate approval of the Elder Care Act represents an effort by lawmakers to address some of these long-term concerns. Many seniors want to understand whether this bill could affect healthcare coverage, caregiver support, home assistance services, transportation programs, meal programs, community care services, or retirement-related assistance. While different proposals may contain different details, elder care legislation generally focuses on improving quality of life for aging populations. Healthcare remains one of the biggest concerns for retirees. Medicare already provides health coverage for many seniors, but out-of-pocket costs can still be high. Many older adults spend significant amounts of money on prescription drugs, dental care, vision services, hearing aids, medical equipment, and specialized treatments. Some lawmakers have argued that elder care reform is necessary to reduce financial pressure on retirees who live on fixed monthly incomes. Families caring for elderly relatives are also closely watching these developments. Caregiving responsibilities can create emotional, physical, and financial stress for family members. Many caregivers balance jobs, children, and caregiving duties at the same time. Supporters of elder care reforms often say that caregivers need additional resources, training, financial assistance, respite services, and workplace flexibility. Improved caregiver support could help families provide safer and more stable care for aging relatives. Another important issue connected to elder care is workforce shortages. Across the country, healthcare facilities and caregiving organizations have reported shortages of nurses, home health aides, caregivers, and support staff. This creates challenges for seniors trying to access quality care. Some parts of elder care legislation may include workforce development programs, training incentives, funding support, or recruitment efforts designed to strengthen elder care services nationwide. Housing is another challenge affecting seniors and retirees. Rising housing costs have made affordability difficult for many older adults, especially those relying mainly on retirement income. Some seniors struggle to maintain homes, pay rent, or afford assisted living arrangements. Discussions around elder care often include affordable housing assistance, accessibility improvements, and supportive living programs for older adults. Transportation is also an important issue. Many seniors no longer drive or face mobility limitations. Reliable transportation can affect access to medical appointments, grocery stores, pharmacies, and community activities. Programs that improve transportation access for seniors may help reduce isolation and improve quality of life. Social isolation itself is another major concern for elderly populations. Studies have shown that loneliness and isolation can negatively affect physical and mental health. Community programs, wellness centers, meal delivery services, and social support networks are often discussed as part of broader elder care improvements. Mental health support for seniors has also become a growing focus. Older adults may experience anxiety, depression, grief, memory loss, or cognitive decline. Access to counseling, mental health services, and dementia-related support programs may become increasingly important as the population ages. Families dealing with Alzheimer's disease or other forms of dementia often face significant caregiving challenges and financial burdens. Elder care policies sometimes aim to improve support systems for these families as well. Another major topic connected to the Elder Care Act is home-based care. Many seniors prefer to remain in their homes rather than move into nursing facilities. Aging at home can help seniors maintain independence and comfort, but it often requires caregiving assistance, medical support, home safety modifications, and regular monitoring. Expanding home-based care services could allow more elderly individuals to avoid institutional care when appropriate. Technology may also play a role in future elder care systems. Telehealth services, remote monitoring devices, emergency alert systems, medication reminders, and digital healthcare tools are becoming more common. Supporters of elder care modernization often argue that technology can improve healthcare access and safety for seniors, especially those living in rural areas or facing transportation difficulties. Rural communities face unique elder care challenges because healthcare providers and caregiving services may be limited in remote regions. Seniors in rural areas may travel long distances for medical care, specialist appointments, or rehabilitation services. Some elder care initiatives focus on expanding healthcare access in underserved communities. Financial protection is another important subject for retirees. Elder financial abuse, scams, fraud, and exploitation continue to affect many seniors. Lawmakers and advocacy groups frequently emphasize the importance of protecting elderly individuals from financial crimes. Educational programs, fraud prevention efforts, and stronger legal protections are often discussed in elder care policy conversations. Nutrition and food security also affect many seniors. Some retirees struggle with rising grocery costs or limited access to nutritious meals. Community meal programs, food assistance initiatives, and senior nutrition services may help improve health outcomes for older adults. Proper nutrition can reduce health complications and improve overall well-being among aging populations. Veterans who are seniors may have additional health care and support needs. Some elder care policies work alongside veterans' programs to improve health care access and caregiving services for elderly veterans. Disability support is another important area because many seniors live with mobility limitations or chronic health conditions that require ongoing assistance. Emergency preparedness for seniors is also important. Natural disasters, extreme weather events, and public health emergencies can create serious risks for elderly populations. Seniors may require additional evacuation support, medical supply access, or emergency response assistance during crises. Policymakers often discuss ways to improve emergency planning for vulnerable populations, including older adults. Retirement security remains one of the biggest financial concerns in the country. Many retirees worry about inflation, healthcare costs, housing expenses, and the long-term stability of retirement income. Although the Elder Care Act may focus primarily on care services and support programs, broader conversations about senior well-being often include Social Security, Medicare sustainability, retirement planning, and cost of living concerns. Seniors should always review official government information before making financial or healthcare decisions based on legislative news. It is important to understand that legislation approved by the Senate may still go through additional legislative processes depending on the structure of the bill and government procedures. Sometimes bills require approval from other chambers, revisions, negotiations, or implementation planning before changes fully take effect. Government agencies may also need time to create regulations, funding structures, eligibility requirements, and program guidelines. This means that not every proposal becomes immediate policy overnight. Seniors and retirees should remain informed through official announcements from trusted government agencies and verified sources. Advocacy groups for older adults have long argued that stronger elder care systems are necessary because the country's population is aging rapidly. Millions of baby boomers are now entering retirement years, increasing demand for healthcare and caregiving support. Healthcare systems, nursing facilities, and home care providers may face increasing pressure as this demographic shift continues. Policymakers have debated for years about how to improve affordability, accessibility, and quality in elder care systems. Another important aspect of elder care discussions is family caregiving economics. Many unpaid family caregivers spend large amounts of time and money caring for elderly relatives. Some reduce work hours or leave jobs entirely to provide care. This creates financial stress for households while also affecting the economy more broadly. Supporters of caregiver assistance programs say that helping caregivers can improve outcomes for both seniors and families. Long waiting lists for certain care services have also become a concern in many states. Some seniors face delays when seeking home care support, Medicaid waivers, or specialized services. Expanding funding and workforce capacity could potentially reduce waiting times and improve service access. Nursing home oversight and quality standards are another ongoing topic. Families want reassurance that elderly loved ones receive safe and respectful care. Lawmakers sometimes propose stronger regulations, staffing requirements, transparency measures, or accountability standards for long-term care facilities. Healthcare affordability continues to dominate discussions involving retirees. Even with Medicare coverage, many seniors still face deductibles, co-pays, and uncovered expenses. Prescription drug affordability has become especially important because many older adults require ongoing medications for chronic conditions. Some policymakers support reforms aimed at reducing drug costs or increasing assistance for low-income seniors. Community organizations often play a major role in supporting elderly populations. Senior centers, nonprofit groups, religious organizations, volunteer programs, and local agencies provide valuable services including transportation, meals, wellness activities, and companionship. Expanding partnerships between government agencies and community organizations may strengthen support systems for older adults. Digital literacy is another issue affecting many seniors. As healthcare systems, government services, and financial tools become increasingly digital, some older adults may struggle with technology access or online navigation. Programs that help seniors learn digital skills may improve access to telehealth services, benefits information, financial management tools, and communication platforms. Care coordination is another important topic in elder care reform discussions. Seniors with multiple medical conditions often see several doctors and specialists at the same time. Better coordination between healthcare providers may reduce confusion, improve treatment outcomes, and prevent unnecessary hospital visits. Preventive healthcare services are also important because early detection and routine care can reduce severe health complications later. Wellness programs, exercise initiatives, vaccination campaigns, and routine screenings may improve health outcomes among seniors. Policymakers sometimes support preventive care investments because healthier populations may reduce long-term health care costs. Another concern for retirees is inflation. Rising costs for groceries, utilities, rent, insurance, and health care can significantly affect seniors living on fixed incomes. Many retirees carefully monitor economic conditions and government policies that may influence financial security. While elder care legislation may not directly solve all economic challenges, supporters argue that improved care systems can reduce stress and improve stability for older adults. Accessibility improvements are also part of broader elder care conversations. Seniors with mobility challenges may need home modifications, wheelchair access, transportation assistance, or adaptive technologies. Improving accessibility can help older adults remain independent longer and participate more actively in community life. Cultural and language differences also affect elder care services. Diverse communities may require multilingual healthcare support, culturally appropriate caregiving services, and inclusive outreach programs. Policymakers often discuss the importance of making elder care accessible to all populations, regardless of language or background. Public awareness campaigns may also play a role in future elder care efforts. Educating families about caregiving resources, healthcare planning, fraud prevention, and available support programs can help seniors make informed decisions. Retirement planning education may also become more important as people prepare for longer life expectancies and changing economic conditions. Some experts believe that improving elder care systems requires cooperation between federal agencies, state governments, healthcare providers, insurers, community organizations, and families. Because elder care involves many different services and funding systems, coordination can be complex. Policy implementation may vary across states depending on funding structures, healthcare networks, and local programs. Seniors should pay close attention to official guidance regarding eligibility, application processes, and program availability. Another issue connected to aging populations is workforce participation among older adults. Some retirees continue working part-time or delay retirement due to financial needs or personal preferences. Employment protections, flexible work arrangements, and retirement planning resources may become increasingly important for older workers. Age discrimination concerns are also sometimes discussed in broader conversations about senior well-being and economic security. Healthcare innovation may continue shaping elder care in future years. Advances in medical treatments, rehabilitation programs, assistive devices, and digital health monitoring could improve outcomes for aging populations. However, affordability and access remain key concerns. Lawmakers often debate how to balance innovation with cost control and accessibility. Medicare and Medicaid policies remain central to many elder care discussions, because these programs provide critical support for millions of seniors. Changes in funding, reimbursement systems, or coverage policies can significantly affect healthcare providers and elderly individuals alike. Families often monitor policy updates carefully because healthcare decisions can impact financial stability and caregiving arrangements. Fraud prevention remains especially important for retirees because scammers frequently target older adults through phone calls, emails, fake charities, investment schemes, and impersonation scams. Seniors should remain cautious about sharing personal information and should verify all official communications through trusted government channels. Community safety programs and financial education initiatives may help protect older adults from exploitation. Another growing topic is intergenerational caregiving. Some families care simultaneously for children and aging parents, creating financial and emotional pressures sometimes called the sandwich generation challenge. Support services for caregivers may help reduce burnout and improve family stability. Public transportation accessibility, safe sidewalks, and age-friendly community planning are additional factors that influence quality of life for seniors. Urban planners and policymakers increasingly discuss how communities can better accommodate aging populations through accessible infrastructure and inclusive design. Climate-related health risks may also affect seniors more severely because older adults can be vulnerable during extreme heat, cold weather, storms, or air quality emergencies. Public health agencies often emphasize preparedness measures and community support systems for elderly residents during emergencies. Retirement communities and assisted living facilities may also face evolving standards as policymakers examine quality, affordability, staffing, and resident protections. Families choosing long-term care arrangements often compare costs, services, medical support, safety measures, and quality ratings. Transparent information and oversight can help families make informed decisions. It is also important to recognize that many seniors contribute greatly to communities through volunteering, caregiving, mentorship, and civic involvement. Discussions about elder care are not only about healthcare needs, but also about dignity, independence, inclusion, and respect for older adults. Policymakers and advocacy groups frequently emphasize the value and experience seniors bring to society. Financial literacy programs may help retirees manage budgeting, healthcare planning, retirement withdrawals, and fraud prevention. As retirement systems become more complex, educational resources may become increasingly important. Estate planning, long-term care planning, and healthcare directives are also common topics discussed among retirees and families preparing for future care needs. Another concern for many retirees is caregiving availability for spouses or partners. Aging couples may face situations where both individuals require medical support at the same time. This can create unique financial and logistical challenges for households. Social support networks, community programs, and accessible healthcare services may help reduce some of these burdens. The Senate approval of elder care legislation reflects growing recognition that aging-related issues affect millions of families across the country. Whether through healthcare support, caregiver assistance, housing programs, transportation improvements, or community services, lawmakers continue debating ways to strengthen systems supporting older adults. However, it is important for viewers to remember that policy implementation often takes time and may involve additional government processes. Seniors should remain cautious about misinformation, rumors, or exaggerated claims circulating online. Official government websites and verified announcements remain the best sources for accurate updates regarding legislation, benefits, healthcare programs, and eligibility requirements. Before making any financial, healthcare, or retirement decisions, individuals should consult qualified professionals or trusted agencies when necessary. This topic matters not only to current retirees but also to future generations preparing for retirement in the coming decades. Healthcare systems, retirement planning, caregiving structures, and economic policies will continue evolving as the population ages. Public discussions about elder care are likely to remain important for many years ahead. Families, caregivers, healthcare workers, policymakers, and community organizations all play important roles in supporting aging populations. The goal of many elder care initiatives is to improve safety, dignity, affordability, and quality of life for seniors while helping families manage caregiving responsibilities more effectively. As more information becomes available regarding the Elder Care Act and related policies, seniors and retirees should stay informed through reliable sources. Understanding healthcare options, financial planning strategies, caregiving resources, and community programs can help older adults navigate retirement years with greater confidence and stability. Thank you for watching today's video. If you found this information helpful, make sure to like the video, subscribe to the channel, and turn on notifications for more updates related to seniors, retirees, Social Security, Medicare, healthcare, retirement news, and important government policy updates. Stay informed, stay safe, and we will see you in the next video.